Hi, this is Dr. Ward, and I just wanted to review some post-op instructions for dental surgery. One of the first things that we want to manage is just the bleeding. You left here with some gauze in your mouth. We wanted you to just apply pressure. Generally, after 5 or 10 minutes, you can take that out and then evaluate whether or not it's bleeding actively or not. A little bit of seeping of blood is normal. If it's actively bleeding, take some of the sterile gauze that we put in your pack, wad that up, and go ahead and bite down on that and keep pressure on it for the next 10 or 15 minutes. If after you do that, it hasn't stopped, a lot of times I'll recommend putting a tea bag in, black tea particularly. It's got tranexamic acid that'll help that clot. And most of the time that's enough. If there's other factors with medications that keep your blood thinner, we may need to do some adjustments, and we will have talked about that. But in general, manage the bleeding. That's the first thing that we want to do. Next thing we want to do is kind of how do we manage getting something on your stomach, because you're going to be hungry. You haven't eaten before the sedation, and now we're at a point where we've had this surgery and this wound and trauma. So we just have to be careful, make sure that you're not eating anything real hard. I pretty much recommend a soft diet, meaning almost liquid diet for the first 48 hours. In this wound, you have clots that are forming, that there's no maturity to the clot, and there's just no resilience to it. So it's easily broken up. And then if we lose that clot, then we have bone exposed to air, potential dry sockets. So we really want to be careful for sure for these first couple of days. As much liquid as you can do, ensure soups, anything that's got, protein drinks, whatever like that. You can do noodles, pastas. It's just a little bit more risky and depending on the surgery that you had, but just take it easy. Ultimately, the more delicate we are, the better this will heal long term, and the better chance that you're not going to have complications with whatever we've done. Next thing we want to deal with is just how do we manage pain. You will have left, if you were IV sedated, which my patients usually are, I'm going to give you some medicine IV, so it's going to help you with your pain for 2 to 3 hours after you leave. So it'll give you time to get home, get something on your stomach, maybe start icing, which is one of the things we're about to talk about. But in general, I like to use over-the-counter meds when I can. So I will recommend 200 milligram tablets of ibuprofen, so the Advil, generic Advil. And then depending on the level of the surgery, a lot of times we'll recommend 1 extra strength Tylenol, a 500 milligram tablet, and you combine those and do them together. You can do those every 4 to 6 hours depending on the level of pain. And in general, that's what I like for my patients to do. If it's something that is not controlling the pain and you need more than that, discontinue the Tylenol on the next round for medication. You can take the narcotic that you were given, but don't take Tylenol with it because Tylenol is in that narcotic. Along with that, icing is our friend. Whether you do ice packs or frozen vegetables from the freezer, just something that will adapt to the surgery site, typically 20 minutes on, 20 minutes off, and you're going to want to do that for the first 48 hours. After that, you can do some warm compresses that will help with swelling, but for the first 48 hours, you really want to do ice. So that's pretty well going to manage pain for most people. For depending on your situation, you may or may not have steroids, antibiotics, other things that I've recommended for you to take. Then we also, with you being sedated, make sure that you're not driving and make sure someone's with you, just to make sure you can, when you get up, you don't stumble or have an accident and bring you food. You'll probably go home and sleep. So when you're sleeping for the first 48 hours, I'd like for you to be elevated, whether in a recliner or a couple pillows under your head when you sleep at night, but you want to be elevated just to reduce the swelling. Some of the other things, reduce your activity for a couple of days. You're going to take it easy. You want these wounds to heal, and you don't want to have trouble with that. Try not to smoke. If you're a smoker, wait as long as possible. That's one of the things that I really see more post-op concerns with. You're going to have a medication to rinse with morning and night to get rid of some of the bacteria in your mouth that could potentially cause us problems. When you swish that, be very gentle. You're not vigorously trying to swish that and clean out the wound. You really want it on the surface of the wound. Kind of let gravity stay in that area, hold it in the area, gently rinse it, and then gently spit it out. But you'll want to do that for at least 30 seconds. Other than that, in terms of cleansability, how you clean your mouth, I don't want you brushing on the wound directly. There may be specific situations with certain types of membranes that we're going to clean after a couple of days, but in general, brush the teeth, whether it's the prosthesis or your teeth normally, but don't brush the wound. Obviously, we don't want to disrupt that clot. We want to let that heal. Other than that, I have other written instructions that I will have given you, but hopefully this makes it a little bit easier, and pretty generalized information about going home instructions after surgery. Thanks.